and today we will talk about the COVID-19 vaccines. Please let me know if you see the screen and if the sound is good.
Yes, we can see the screen. Sound is good also.
Thank you so much. So let's start. The topic is kind of difficult, but I will try to make it easier for you. We will talk about the most actual questions because there is a lot of information about the COVID vaccines, and I want to answer for your questions if you will have it. So you can write them in a chat or to ask after the session. The first slide is coronavirus vaccine tracker. It is produced by New York Times and the link is active. You can check the actual information about the vaccines on this tracker. It is very simple to use and you can see how many vaccines and on which phase they are and which vaccines we have. The information is regularly updated. This slide with information which was updated on the 13th of April. So for now we have 5 authorized, 8 approved, and 4 abandoned vaccines. The other one are still in the phase 1, 2, or 3 of clinical trials. So what is it, clinical trial? It is a long way to create a safe and effective vaccine, and we have a short period to create it due. Do you see the changing of the slide?
No, Dr. Viktoriia, only the first slide.
Viktoriia. No, it's only the first thing.
Thank you. One moment. And now?
Yes, now I see the third slide.
Okay, good. So the first phase.
Second slide, please go back.
The second, that one. This actual picture for tracker and the amount of the vaccines which. So?
We don't see the second slide. Yes, thank you.
Okay. Please let me know if the slides will stuck again.
It's still the second slide. They don't change. Yes, thank you.
Maybe we will work in this way to make you see the slides. Okay, now should be slide about the phases of clinical trials. So.
Yes, we see them.
Yeah, thank you. So the first period for the future vaccine is preclinical testing. It is scientists test a new vaccine on cells and then give it to animals such as mice or monkey to see if it is produce an immune response. Then, if it works, the vaccine go on the phase 1. It is safety phase. Scientists give a vaccine to a small number of people. It is volunteers to test safety and dosage, as well as confirm that it stimulates the immune system. Then phase 2, during the phase 2, scientists give the vaccine to hundreds of people, split into groups such as children or elderly, to see if the vaccine acts differently in them. These trials further test the vaccine safety. Phase 3, mostly it is efficacy phase. Scientists give the vaccine to the thousands of people and wait to see how many become infected compared with volunteers who received a placebo. These trials can determine if the vaccine protects against the coronavirus, measuring what's known as the efficacy rate. Phase 3 trials are also large enough to reveal evidence of relatively rare side effects. Early or limited approval. This is a very new phase for us to hear. So many countries have procedures for providing emergency authorization for vaccines, and the COVID pandemic is a very emergency situation to perform this authorization. It is based on preliminary evidence that they are safe and effective. In addition, some countries, such as China or Russia, began administering vaccines before detailed phase 3 trial data was made public. Experts have warned of serious risk from jumping ahead of these results, but this procedure was conducted with the Sputnik Russian vaccine and in China with their vaccines. Approval. Regulators review the complete trial results and plans for the vaccine manufacturing and decide whether to give it full approval. And there is a combined phase. What does it mean? One way to accelerate vaccine development is to combine phases. Some vaccines are now in phase 1 and in phase 2 trials, for example, which this tracker, this New York tracker, would count as both phase 2 and phase 1. And we have abandoned or paused vaccines because investigators observed worrying symptoms in volunteers, and then it was decided to stop the trial and to stop the developing of this vaccine. So we have 4 candidates which were stopped in their investigation. So the very actual issue, and we have a lot of questions in float about the antibody testing. Antibody, or they are called serology tests, look for antibody in your blood and determine if you had an acute infection or you met this virus before. Antibody is a proteins, it is immunoglobulins, and they are created by immune system after the antigen insert the cell, or when we get it in our body. A big amount of antibodies are created as an answer for this antigen. They can help to fight off the infection and to protect from the reinfection from this disease again. And this, the term of this immunity can be different due to the different antigens. The antibody test should not be used to diagnose a current infection with the virus in context of COVID-19. For this diagnostic goal, we should use only the viral testing. The antibodies test may not show if you have a current infection, because it can take from 1 till 3 weeks after the infection for your body to make antibodies. And this term can be very individual. You can perform this test on the 7th day of the disease, which is regularly could be recommended. But for you, it could be not enough to get the antibodies. So this test is not used to diagnose the acute infection. And what do results mean? We have two kinds of immunoglobulins, of antibodies. It is immunoglobulin M, which is related to the acute infection. So it is produced earlier than immunoglobulin G. And immunoglobulin G, it is protein for the immune memory. So if you test positive for the immunoglobulins, a positive test results show you may have antibodies from an infection with the virus that causes COVID-19. But there is a chance that a positive result means that you met some other virus from coronavirus group. And it is not very specific for this coronavirus group, and we can't say that this antibody is specific for SARS-CoV-2. The next point is having antibodies to the virus may provide protection from getting infected with the virus again. The main word here is may, because actually we don't know for how long this immune system can provide the protection. And there were reported the cases of reinfection instead of the high levels of antibodies. Talk to your healthcare providers, next point, about your test results, because sometimes it is very important to explain the results and to understand it in the right way. You should continue to protect yourself and others, since you could get infected with the virus again. It is related to the second point, because we don't know how long this immune answer can work. The recommendations are to use PPE for those who use it during work, and you may test positive for antibodies even if you have never had symptoms of COVID, and it is called asymptomatic infection. And this immune answer, as usual, it is not enough to protect you from reinfection. So you should be very careful even if you have this test positive. If you test negative, you may not have ever had a COVID, and you could have a current infection or being recently infected. So the antibodies can be only in process of creation by your organism. The test may be negative, as I said, from 1 till 3 weeks after the infection. And some people actually don't have these antibodies even after the confirmed COVID-19 infection. If you get some symptoms, you should perform a viral test, not an antibody test. The test may be negative because of the laboratory issues, of course, and even if you have symptoms and you check the antibodies, you actually can expect some not severe COVID, but it is not enough data to say that these antibodies will protect you in 100% way. So let's see. As I talk, immunoglobulin M, the producing of these immunoglobulins starts from the 7th day, but it could be individual. It can start from the 10th day or 14th day. Actually, the process is begin from the beginning of the symptoms, but it is not enough amount of the antibodies in your blood to detect it in this period. So they are only increased. And from the 7th day, we can try to detect it in your blood. And then they decreased till the end of the disease. The immunoglobulin G, it is your protection for the future times. And it says that you had this disease and the immune system created this specific protein to kill the coronavirus. It increased somewhere between 21st and 28th day, but it could be individual. And then the level is decreased. But in the human organism, we have memory cells, immune memory cells, which can start the producing of immunoglobulin G when you will be reinfected. So they remember the structure of this molecule, and when you catch again COVID antigen, they stimulate the other immune cells to produce these specific antibodies. This is how our immune system works. So let's talk more deeply about the vaccines which we have. There are many concerns about the vaccines which are all in the third phase trial. They are not finished, so people have concerned if it is safe or and effective, and why should I be vaccinated? So I copied the CDC's text. They are sure that COVID-19 vaccines are safe and effective. And the quickly development of this vaccine was needed due to the high spread of the virus, but the vaccination is the only way to stop it. We should use it, and we should stop this pandemic. The next point is about the specific of the vaccines. We don't have for now a live vaccines. What does it mean? Live vaccine contain a live virus, a coronavirus, and we don't have such vaccines for now. We have only inactivated or some generics vaccines. We don't have a live virus, so you can't be infected with the vaccine. It don't belong which vaccine it will be, if it will be Estrogenica or Moderna or Pfizer or Gamaleya. You cannot catch the infection because it is only the part of the coronavirus, or it is inactivated virus, so it is a dead vaccine. No live whole viruses in these vaccines. On the picture you can see the conditions for the most used vaccines. Oxford University AstraZeneca, which is used in Ukraine. It is viral vector vaccine. We will talk about it. What does it mean? It have 2-dose hem, and you can see the temperature levels to store and to transport the vaccine. In addition, we have only 3 vaccines for now approved by WHO. It is Moderna, Pfizer, and it was Johnson & Johnson vaccine, but it was stopped to use due to the complications. I will talk about it. So Moderna and Pfizer, it is RNA vaccine. They contains a part of the virus genetic code. They have 2-dose hem, and it is difficult to get it, especially Pfizer, difficult for Ukraine, because the conditions are very strong, and Ukrainian organization, which is called Ukrvaccina, cannot provide this transportation chain. So because of this issue, we still don't have Pfizer, but it is promised to be transported in Ukraine. The other vaccines are stored in the not very strict condition, as you see. Gamaleya, it is Russian vaccine. It is viral vaccine. It is very same with the AstraZeneca, but for the first and the second dose of AstraZeneca, we use one type of adenovirus. For the Gamaleya is used 2 different types for 2 doses of the adenovirus. So the immune system do not kill on the second dose this adenovirus, which transport the specific coronavirus protein. So the effectiveness rate is high than from AstraZeneca. As you heard, I think we have Sinovac for now in Ukraine, but it is still not approved by WHO because of the low rate of efficacy and the low data about this efficacy. So they are still waiting for some other information, analyze it, and we will inform you if we will have some information too. And Novovax is not in Ukraine and even is not registered in Ukraine. It is protein-based vaccine, and as you see, most of them have 2-dose hem. We have this slide in the last session about the COVID vaccine. It is a short reminder which kind of vaccines we have. Using a whole virus or bacteria, parts of the virus or bacteria, and just a genetic material. It is 3 main types of the vaccines. The whole microbe approach, it is inactivated when the virus or bacteria was inactivated by some chemicals or physical conditions. Leaf attenuated vaccine and viral vector vaccine. The other one are subunit approach. It is used one part of the virus. It is the main causative agent, which is used to produce the immune answer for the antigen. And the genetic approach, it is nucleic acid vaccine. It is not very new technology, but it was created at first for the coronavirus disease. It is used an mRNA part of the genetic material of the COVID virus. Here it is information from the New York Times tracker, and there are main vaccines which are used. As you see, you can see a status. It is a list of the countries which approve the vaccine for the emergency use, the technology for the producing of the vaccine, and phase of trial, which should be finished for now. The vaccine which are approved and which are widely used are still on the third phase and combined actually with the second phase, but they get a first efficacy point. So the information why they were approved was received from the first part of the trial, from the main part of the trial, and this information were analyzed by the specific organizations like FDA for America, EMA for Europe, and analyzed by WHO, and it was approved due to these data. But the full phase 3 trial with the full side effects, full rate of efficacy, all follow-up information about the patient, it is usually lasts a few years. So we cannot wait these years because we have a very bad statistic with this COVID, and we have this pandemic. So it was decided to use this vaccine in an emergency way. This vaccine, which I was told, Johnson & Johnson, it is stopped in the widely using because in America received information about the early blood clotting, and this blood clotting is not very, it is specific, and it is only on investigations for now. It was in the last few days, so we will wait some information, but we don't have this Johnson & Johnson in Ukraine, and it was not used in Ukraine and even not registered. Then let's talk about the vaccines which we have in Ukraine. Do you see the slide about the Estrogenical vaccine?
Yes, Dr. Viktoriia.
Thank you. So let's talk about this vaccine. In Ukraine, it is registered as Covishield because it was produced by Serum Institute of India. It is not a generic drug or something else. It just the AstraZeneca Institute provide their specific technology, their specific formula of this vaccine to the Serum Institute, and actually they teach this institute in the all necessary issues, and only then, when they check that the technology is safe, they agreed to provide this vaccine for the Serum Institute. So it is viral vector vaccine. What does it mean? The vector, it is not the virus which is caused by COVID-19. It is the other virus. In this vaccine, it is adenovirus, which was transformed during gene engineering. So it cannot cause the adenovirus infection in human body, and in this virus was injected, was hidden in this adenovirus the very specific for SARS-CoV-2 protein, S protein, or it is called spike protein, which is look like corona on the surface of the virus. And actually we call this virus because of these spike proteins. And when these adenovirus are inserted in your body, it is the virus is dying after the immune answer of the cells, and these specific protein stimulate the immune system to provide the specific antigens. We have actually a lot of questions why the scheme of the vaccinations for AstraZeneca was changed. The period between the first and the second dose is, for now, it is 3 months, because it was shown in the trials that when this period are longer, the efficacy rate of the vaccine grows in the very better way, about 79%. So it was decided to change the scheme to get a more more efficacy rate for the protection. And of course, let's talk about the last reactions, which was in Ukrainian social media and actually in media about the blood clots, and after the AstraZeneca vaccine. So this is recommendation of European EMA, and I left here an active link. Then you can check the document. It is a total review for these signals, for these thrombosis, and they include the not very typical thrombosis. It is called, it is actually very severe, but it is not very often, and it is only risk for thromboembolism. And officially we have this blood clotting in the side effects for now, and severe allergic reaction was included. And the recommendations are not to stop the vaccinations with this vaccine, because after the analyzing the data of the amount of the vaccinated people and the amount of these severe adverse event, it was decided that it is nothing in context of pandemic, but the recommendations are to be aware with this thromboembolism and to consult with your healthcare provider, with your physician before the vaccination. If you have some chronic conditions with the coagulation system, or you have some high risk of thromboembolism, you should not be vaccinated. So it is very important to talk to your doctor and to measure all your individual risk before getting this vaccine. And the main recommendations are to provide the vaccination, but for people who have some risk factors and the other vaccine is available, it is better to perform vaccination by the other vaccine. In case the other vaccination is not available, you can be vaccinated by AstraZeneca after the consultation with your healthcare professional. And you should be aware, you should be informed about the developing of symptoms after the vaccination about the 14 days, such as shortness of breath, chest pain, leg swelling, persistent abdominal pain following vaccination. It is the symptoms to immediately go for the medical help. And actually you see the link here in the right corner. It is from the Ukrainian register. The vaccine is registered in Ukraine for emergency use. The next vaccine, which is registered in Ukraine, it is Pfizer. Her name is Comirnaty. And you can see the link for her registration too, and we are waiting actually for this vaccine. She has a very high efficacy level, about 98%, and it is mRNA vaccine, but there are many myths about this vaccine. mRNA never enters the nucleus of the cell, which is where our genetic material is kept. It cannot transform our genetic material in never. And the cell breaks down and gets rid of the mRNA soon after it is finished using the instruction. So it is a very very clever and simple way to deliver this genetic material of the virus by this vaccine. So your cell will produce a specific molecules of COVID-19 after getting the vaccination. The benefit of mRNA vaccines is those vaccinated gain protection without ever having risk the serious consequences of getting sick with the COVID-19. We will have a presentation about side effects. I will not stop on this question. Of course, there are some side effects, but no messages about some severe issues for the last time. And the third one is Sinovac, which was registered in Ukraine too. But it is a Chinese vaccine, and they also have Sinopharm. It is inactivated virus in the vaccine, and her efficacy rate for Sinovac, as you see on the slide, it is just 50% and more than 80% respectively. It is not so high to approve this vaccine for the international organizations. So it is the trials are prolonged, and we still have no data about it. It is approval, so we will wait about some information and we'll inform you. This slide I hope you remember. It is Ukrainian Roadmap. You can read it. I will not stop on this issue again. I just want to tell you that how it works for now in Ukraine. It is very important to have a family physician and to have a declaration with your family physician. And there are some ways to receive the vaccination if you want. As we talk, for now we have available only Covishield, and as you know, in the one bottle we have 10 doses for the injection. And in the governmental structures, they should utilize the vaccine even if not all doses are used. We have too many concerns from people. They refuse to be vaccinated from the priority groups. So we have some doses left in the bottles, and the doctor from the vaccination point conduct some waiting list for such person who wanted to be vaccinated, and it is a very simple way to get your vaccine a little bit earlier if you are not a priority group for this vaccination. And as you see, the way is very long, and we need a huge amount of doses to vaccinate all risk groups, and the process will be very long, and we have high levels of the disease now. So it is a very simple way to get the Estrogenica after the consultation with your physician. This information is provided for now. It is actual. I hope something will change in weeks or in days or in a month, but I hope we will have more available vaccines in Ukraine, and I wish you to be vaccinated, and I wish you not to have side effects, and stay safe, and don't forget to use your protection even if you are vaccinated. So I have finished with the main information. Thank you so much for your attention. If you have any question, I will be happy to answer if I can.
Yes, Veronica. Go ahead.
Yeah. Thank you very much for the just question regarding the vaccination of these teenagers. What would be your opinion in case there is possibility to vaccinate the teenager younger than 18? Would you recommend to do this on? Thank you.
About the vaccination of teens, as I know, Pfizer started trial for vaccinations of younger people, but we still have no data about the recommendation. And actually, Pfizer is the youngest vaccine. We can start vaccination for the people from 18, but it is better to wait some recommendations about the vaccination of the children because the organism of the child, it is not a little adult. It works in a very other way, and it is important to have some results of trials or to be vaccinated during some trial when it is more than safe, you are more than controlled during when you are volunteering in the trial. So my opinion and my recommendation is to wait some official data about the vaccination of the children.
Thanks, Leah.
Natalia, yes.
Yeah, I have a question about Sinovac, Coronavac. Since it's so, I mean, it has so low efficiency, if there is any sense to kind of try to get vaccinated with it?
The main concerns about the Sinovac is that the trials were conducted in China and in Turkey, and the efficacy level was very different, from 50 till 70%. But 70, it is very good result actually for the vaccine, but 50, it is not so good. With this information, the international organizations have concern to approve it, and they are waiting for some additional information to approve this vaccine. I cannot answer if we should be vaccinated by Sinovac, because we should wait some recommendations of the authorities which can say that this vaccine can be approved, and if they approve this vaccine.
Thank you. And if I may, I would like to ask another question. It's about AstraZeneca, because certain countries kind of suspended the use of it. And I remember there were countries who said, okay, people older than 60 years old shouldn't be kind of using it. And then in some countries, it was actually for people younger than 60 years old. And I wonder actually, what to believe, especially for persons who are really old age, like, older than 80 years old and with some underlying health conditions. And I'm asking it because family doctor cannot really kind of provide an advice, resolutive advice whether to get vaccinated or not for a person like nearly 90 years old.
Mm-hmm. The information about the strong level of the age to be vaccinated was very different, but it is more important to measure your thromboembolic risks, because you can be 30, but you can have some thrombotic issues in anamnesis and receiving some medications. So it is very individual to measure this risk. In the contact, the doctor should measure it, especially with you, to get this decision if it is more safe for you to get the vaccine and to not have a severe COVID and a risk of mortality, or it is not safe for you because the level of the thrombotic issues is very high for you. So I'm saying that it is not about age, it is about your individual medical and family history.
Thank you.
I see one more hand.
Can I add, Dr. Viktoriia? So
yes, Dr.
Just about efficacy and for that all vaccines. We not should seek for better efficacy. We should seek for vaccines that proven to be safe to deal with. So any vaccines that you can catch and take shot, it is good vaccine. For example, if you want one example, so as flu vaccines that we have each year, efficacy of that vaccine is between 40 and 60%, but it's proven to be reduce hospitalizations of people and mortality. So anyway, any efficacy that above than 40, it will be greater than nothing. Over from my side.
Yeah, thank you. I totally agree with your addition. The recommendations are to be vaccinated. If you have an alternative, so if you can choose the vaccine, you should choose the vaccine without the side effects of thrombotic issue if you are in the risk group. But if there is no choice, the EMA recommends to be vaccinated instead of no, because for people from risk group, it is very high risk to get a severe COVID, unfortunately.
And I have another question. Are there any studies that show for how long the immunity from the vaccines last?
Oh, thank you for your question. This information we can get only when this phase 3 trial will finish. And to measure this level of immunity, scientists need more information and at first more time to see how that was, how vaccines was work for the people who was vaccinated. So I think that we will have this data in maybe in a year or maybe half a year. We will have this data, but it is recommended to be vaccinated even if you had the COVID-19 and more than 3 months before. And let me check. I think no questions in the chat. So, okay, we will wait for 1 minute and then finish in case you will have some questions or you want to be consulted by a physician, float physician. We are open to answer for your questions and for your suggestions for the other webinars for the topic which you are interested in. So you can call us and we will try to help you in the very proper way. So, okay, let's finish. Have a good day. Thank you so much for your attention. Bye, colleagues.